state of our hospital buildings is a national scandal. Everybody in this country should be in control of their own lives and their own health. And that means everybody should get the care they need, when they need it, and where they need it. But that can never be realised while so many patients are treated in settings that are grossly inadequate. From Shropshire to Cornwall to Cambridgeshire, Watford and Devon, patients are losing their dignity because of decisions taken by the Conservatives and the current Labour government's failure to rectify them. The Conservatives' record is one of starved repair budgets, sewage leaks, crumbling ceilings and bucket-strewn wards. It's an outrage that millions of people are waiting for treatment, and yet overcrowded hospitals have had to close operating theatres because they are no longer fit for use. Patients and the staff who work in hospitals deserve the dignity of safe, modern and clean environments. But instead, the last government shamefully chose to raid the repair budget to plug the gap in day-to-day costs as our hospitals fell apart. And now the new government, having been elected on what is increasingly looking like false hope, is pursuing a false economy by delaying the desperately needed new hospitals programme. Like so much of its agenda, having promised so much, the government is delivering so little and betraying those who put their faith in the Labour Party. Farmers who were fed up with the Tories, who took them for granted, have been hit by a tax grab on their families' futures. Employers who were promised growth and no new taxes have been whacked by an increase in national insurance, and patients who were promised new hospitals have had them taken away from them. The issue we have here is that the start dates for many of the hospitals that urgently need rebuilding have been pushed back into the 2030s, long beyond the life of this Parliament. And the people who are served by those hospitals were promised new facilities and they haven't had them, and that's devastating for those communities. So if the Conservative approach was contemptible, Labour's approach has been to procrastinate. The cost to the NHS of papering over the cracks and keeping hospitals running past their natural lifespan is enormous. That's why the government must reverse the delay to the new hospital programme at once and urgently deliver the new hospitals that patients have long been promised. It's important to recognise that the additional investment in the NHS, if you look at the numbers from the ABR, and I'm sure the gentleman has, it amounts to about £10 billion a year. Because of the cost of the national insurance hikes and the cost of compensating other public sector employers for those hikes. So the £22 billion is somewhat misleading. And the point that we are trying to make is that it is a false economy to keep these buildings going with a crumbling estate, to keep repairing them, patching them up, putting a sticking plaster on those problems, when those buildings need to be demolished and rebuilt. It's a false economy. It would be much better to build them up front and save those repair costs in the future. So we need to ensure that no one is treated in broken, uncomfortable and unsafe facilities. Repairing and replacing, as I've just said, crumbling substandard hospitals is not only vital for delivering better care and treating more patients, it's crucial for rebuilding the economy after years of economic vandalism. So how much does all this cost? In my county of Shropshire, the cost of the maintenance backlog across all the sites has reached about £75 million. And I'm sure everyone here would agree that £75 million is a lot of money. Indeed, it's so much that it's the total amount of capital investment the government has given for hospices this year. But in terms of hospital maintenance, it's a drop in the ocean. Hospitals like Torbay need more than £50 million to clear the backlog. Hospitals like Watford have a backlog of £63 million, I will in a moment, while Hull Royal Infirmary requires an eye-watering £70 million. Across England, the figure is a colossal £13.8 billion, and that is just to bring our existing hospital estate up to a minimum standard. We would invest to save money in the long run, rather than frittering money away on a repair bill for buildings that need to be demolished. It is not sensible to pour good money after bad when the right thing to do is invest in the new estate, invest in a fit-for-purpose, modern estate that doesn't have these endless and extortionate maintenance requirements every single year. No. I'm going to make some progress, if that's okay. So, At North Devon District Hospital, the ducting of the ventilation system that serves the operating theatres hasn't been changed since it was installed in 1979 and can't be replaced due to the ceiling height and the asbestos that's present there. As a result, all operating theatres have been non-compliant with NHS England buildings guidance since 2007. Now, the good people of Devon clearly need a new hospital. They were promised they would have this by 2030, only for the Labour government to take this away and decide the change they need won't be delivered for another decade. Even hospitals with comparatively few maintenance problems, like Royal Shrewsbury Hospital, which serves my constituents, with its £35 million backlog, are clearly a long way short of being up to standard. Now, I'm not going to go into detail again today about the catalogue of issues in Shropshire, the ambulance delays, the ambulance station closures, the waiting times for check-ups, scans and surgeries, the substandard state of cancer care. But all this is combining to put huge pressure on hospitals, where both the staff and the buildings are straining under the load.
Mr Speaker, can I commend the Honourable Lady and the opposition Lib Dem party for bringing this forward? It's very important. One of the issues that the Honourable Lady and the party haven't mentioned in their notice of motion is the issue of car parking. It is a continual problem. Those who can't get car parking spaces close to the hospital, those who are disabled, those who are going for appointments which are then delayed or missed. So does the Honourable Lady agree, when it comes to addressing the issue that the party is setting out very clearly what needs to be done, car parking has to be central to that as well?
Intervention. Obviously, car parking is a real problem, particularly where public transport is poor, something that plagues my constituents, and when it's unrealistically expensive for people who need to use the hospital facilities. So I thank him for that point. The point of the NHS crisis is that it impacts on patient outcomes. So patients like my constituent Emma was left in the fit to sit area for 48 hours despite having been diagnosed with suspected sepsis. 96-year-old Mary waited in an ambulance outside for 11 hours. An 82-year-old Paula spent 24 hours in a trolley, on a trolley in a corridor. And this is the reality of hospitals up and down the country. I think we are all agreed that that is a disgrace and it needs to be rectified. One of the main reasons these problems haven't been rectified is successive delays from successive governments. And again, Shropshire is a prime example. So, not related to the new hospital programme, but nonetheless, £312 million was granted for the hospital transformation programme in Shropshire back in 2018. 7 years later, and while the county has been through 5 Prime Ministers and 8 different health secretaries, Shropshire is still waiting for that transformation to take place. There's been opposition from both the Labour and Conservative councils that serve the area, along with a ridiculously lengthy process that capital expenditure has to go through to be signed off. Desperately needed improvements have been horribly delayed as construction costs rise, and as a result, the original plans are scaled back and their value diminished.
On that point.
Oh, give me.
I'm grateful to my honourable friend for giving way. She mentions the inordinate delays that occur for the application for capital funds. I have watched with horror as my local hospital trust in West Hertfordshire have had to submit business case after business case after business case after business case, watching the costs rack up. Would she agree with me that one of the ways that we can actually spend the allocated money more efficiently is actually to devolve those budgets to local hospital trusts rather than having a centralised programme that drives up the costs?
Yeah. I couldn't agree more with my honourable friend, actually, because that's exactly the situation we saw in Shropshire. And once again, the people that will suffer because of that are the patients. Last year, less than £900 million of the £13.8 billion required to eradicate repair backlogs at hospitals was invested. That's just 6.5%. And you don't need to be an accountant to work out that at that rate it will take 15 years to clear the current backlog, let alone deal with the further deterioration of these crumbling buildings, as we have already discussed. Indeed, investment in eradicating the repair backlog has fallen sharply from £1.4 billion in 2021 to £895 million in 2023-24, a fall of 37%. And I'm afraid, just like the approach to fixing social care, the government's continued lack of imagination and ambition is leaving our NHS less productive and less stable, and risks leaving millions languishing on NHS waiting lists. So, just like its approach to fixing social care, The government's continued lack of imagination and ambition is leaving the NHS less productive and less stable, and risks leaving millions languishing on NHS waiting lists, as I said. Now, the last time I opened a Liberal Democrat Opposition Day debate, it was October, and the topic was primary care. I explained how the government's failure to invest in primary care was a false economy that increased pressures and costs in the critical parts of the system. And that same false economy is in place with the management of our hospital buildings. Just as spending money on critical care instead of prevention and public health is a poor approach to managing a health service, waiting for the roof to collapse is an irresponsible way to manage NHS buildings. And as problems are ignored and investment is poorly targeted, it is patients and the hard-working staff striving to help them who are forced to suffer. And it's not only the new hospital programme. Across the country, there are thousands of GP surgeries that need urgent improvement if they are to provide the care that patients deserve. More than 2,000 hospital buildings across England were built before the foundation of the NHS in 1948, while the state of GP surgeries varies wildly as well. Many surgeries are simply no longer fit for purpose, having been built in the 50s. Prescott surgery in my constituency, for example, has long been recognised as somewhere that needs to drastically increase in size because the population of the village has increased drastically itself. And despite the land and the SIL funding being available, there is no sign of a new surgery being built, and the delay continues. The costs are rising, and the challenge grows for both the Council and the Integrated Care Board that are already under immense pressure to cut their costs. So instead of pursuing fantasies like the Conservatives or false economies like the Labour Party, Liberal Democrats would invest to save by starting construction now and ending the epidemic of cancelled operations, closed-off wards, and huge sums wasted on emergency repairs. This will save the taxpayer money in the long run and benefit patients much sooner. The plan that we've put forward involves £10 billion over 10 years, and I will come on to that in a moment. The real issue here is that we can't pick one hospital and say that that is indicative of an NHS which is being dealt with appropriately. Right. There are hospitals across the country that are falling apart. There are hospitals like Stepping Hill in the constituency of my honourable friend that isn't even in the new hospital building programme and yet is falling apart at the seams. Right. And we need to address the whole estate fairly urgently, I would suggest. So, our 10-year guaranteed capital investment programme would provide long-term security and fix the crumbling hospitals and creaking GP surgeries. It would provide an extra £10 billion for our crumbling buildings over the next decade, improving outcomes for patients, boosting productivity and cutting day-to-day costs for the NHS. And the certainty is crucial. As it stands, managers have to raid precious budgets, not just to plug leaking pipes, but to plug staffing gaps when winter pressure arrives. That's why we would also end the reactive approach to the annual winter crisis through our winter task force. Instead of the average £376 million of emergency funding announced late into the winter each year for the last 7 years, our winter task force would manage a ring-fenced fund of £1.5 billion over the next 4 years. This would help hospitals to plan their budgets and build resilience in wards, A&E departments, ambulance services and patient discharging. There are successive failures in NHS management that I think all parties need to hold their hands up to. I think that's a fair point. I think, though, that we should be focusing on the task in hand rather than continually going back decades either to the coalition government or indeed the Plaid government before that. It isn't helpful to our constituents. They want to see a solution now. Now, I've been very generous with my time and I'm going to make some progress. So we're campaigning also for a review of outdated government finance rules which prevent NHS trusts from investing the funds they've raised into their own buildings. Even NHS managers struggle to access the common sense investment in their facilities due to overly complex rules and glacial processes. Trusts are prevented from using unspent funds on improving their buildings. We need root and branch reform combined with this 10-year programme of investment to bring our local health facilities up to scratch. So in conclusion, Mr Speaker, the recent history of the NHS is one of short-term decision-making and of the failure of successive governments to grasp the nettle of long-term sustained investment in the things that matter. Things like hospital buildings, things like GP services, dentistry and pharmacy, and crucially, things like social care, the unspoken crisis. The outcome is an organisation spending millions of pounds and going backwards. It truly is a false economy. This government has spoken warmly of the need to reform the NHS and improve productivity, and we support them in that. But you can't expect to retain staff and provide high-quality care when so many doctors and nurses are negotiating leaking roofs, and sewage backing up on the ward. Dealing with the new hospitals programme is a matter of urgency, and I urge the Secretary of State to, at long last, grasp this nettle.